All right, so Chrissy is going to lead us through a Buteyko demonstration, or guided Buteyko demonstration. So show me what to do.
Okay, well, this is one of the exercises. There's about 6 different exercises we use, and depending on people's symptoms. But what we do as something as a general starting point for people, we firstly are going to focus on breathing, like just nasal breathing. So we want you to be conscious of keeping your mouth shut and resting your tongue on the roof of your mouth in the palate there. And then basically going to be relaxing, making sure your posture's good, you've got 2 feet on the ground, you're comfortably seated, your sitting bones, your back straight. And I want you to really focus on relaxing your shoulders and your chest and your diaphragm, which is your main breathing muscle, primary breathing muscle underneath your rib cage there. So I want you to put one hand on your belly and one hand on your chest. So what we're going to do here is we just want to make sure that the belly is actually where the breath is going into. So really relaxing that, softening the belly, and closing your mouth with your tongue on the roof of your mouth. We're just going to start doing some nasal breathing, and then we're going to go into some small breath holds. So we're going to be blocking the nose and holding the nose for a period of 3 seconds. I'm going to count that down. And then the first breath in is going to be through the nose. Okay, really important, because we want to really grab hold of that beautiful nitric oxide that's been pooling in the nose while we've been holding our breath. Okay, so just relaxing your shoulders, relaxing your diaphragm, and shutting your mouth, resting your tongue on your palate, top palate, and then taking a nice gentle breath in through your nose and feeling that belly expand, and then out through your nose, and really trying to keep your shoulders as still as possible. And then just gently breathing for a couple of seconds and getting that real connection with the breath going right down into your belly through the diaphragm. Okay, now you might get an awareness of how much different that feels for you and how tricky it is, how much you're noticing your shoulders, having to consciously keep those still. Okay, so now that we've done a few of those, we're going to do our first breath hold. So I'm going to ask you to do a gentle breath in through the nose and out through the nose, and then I'm going to get you to actually hold your nose, and I'll count down the 3 seconds, and then you're going to keep your mouth shut and gently inhale through your nose. And importantly, then you're going to try and get hold of your breath, get your breath back to a normal rate as calmly as possible. So keeping those shoulders still and keeping everything as calm as possible, keeping your neck and shoulders relaxed. Okay, so we're going to start with our first breath hold here. We're going to do a gentle breath in and a gentle breath out, and then we're going to hold the nose, hold the breath for 3, 2, 1, and then inhale through the nose, keeping your mouth shut, and then now keeping your body relaxed and get hold of that breath. That may have been quite challenging for some of you. It may have been easy for some of you, depending on where you're at with your symptoms. But that's completely normal, and if it feels too much, then maybe just hold it for 2 seconds. Okay, we're going to do another one of those now. So gentle breath in through the nose, out through the nose, and then hold your nose, hold your breath for 3, 2, 1, and then inhaling through the nose, keeping your shoulders relaxed and bringing that breath back under control in as calm way as possible. And now you might start to feel a bit of calmness, that sense of calm coming into your body, and that's the body's response to this method. So that's the parasympathetic nervous system coming into play and bringing that hormone response at adrenal level down. Okay, we're going to do another one now. So gentle inhale, gentle exhale, and then we're going to just hold the nose for 3, 2, 1, and then inhale through the nose. Okay, and the next one I'm going to do, I'm going to hold it, I'm going to say it a little bit longer, so I'm going to slow the count down a little bit so that you're going to actually extend that breath hold. If it's too strong for you, then just let go and inhale through your nose. Okay, so taking a nice breath in, a gentle breath out, hold your nose, hold your breath for 3, 2, 1. And then inhale through your nose and keeping your body as calm as possible as you get your breath back under control. Beautiful. Good job, Kate. Perfect. Those shoulders are not moving at all. That's good. How does that feel? Can you start to feel, did you feel any physical
I felt
responses?
dizzier when we started doing the breathing, sort of a relaxed dizziness. And then I felt much calmer after the second one. And then I started getting the saliva that you've talked about before in my mouth. Mm.
Yeah, yeah.
Mm.
Yeah, so that's it. So we would do that for, maybe 3
Okay.
to 5 minutes. And that would be classified as, an exercise
And if I was
sequence.
doing that at
And then we start
home,
to build.
sorry, if I was doing that at home, would I
Yeah.
do it once a day or twice a day, or what do you recommend?
Well, it's a magic question for the Buteyko practitioner. We're always going to say as
Okay.
much as possible. So I would start as a routine 3 times a day. But basically, the more you do it, the quicker you get the results. The quicker the brain starts to change. Basically, that is it. So the more you can do it, the more often you can do it, the better you're going to get at it, and the more you're going to be able to move through to the more difficult exercises, and the quicker your symptoms are going to decline. The quicker
Yeah.
you're going to get your health back, get on top of all those health
Okay,
issues.
fantastic. So 3 to 5 minutes as many times a day as you possibly can. Thank you so much.
Yeah, but let's say 3 times a day. Let's say
Okay.
3 times a day for the
All right.
minimum. So that would be great. You can do it 3 times a day, like a full sequence of that. And then, obviously, if you're sitting at the traffic lights, do it for a couple of minutes.
Fantastic. Thank you.
All right. Thanks so much, Kate.